Hello. Hello. How's that for a fake Starbuck? Welcome to Chat with the Docs. I am your host, Mo Wolf, the acupuncturist here at the Siloam Center for Traditional Medicine. That empty chair is where Dr. Noel will be perched in just a short time. She's finishing up with a patient in the other room, and she will be with us shortly. For right now, though, we're running a skosh late, and I beg your pardon for that. But I just wanted to mention a couple of things. Number one, if you want to be part of the show, give us a call, 608-314-8791, and Carrie will patch you through. And you can pick the brains of a chiropractor and an acupuncturist all at the same time. I mean, they don't even get to do that in anatomy laboratories. They poke brains, but not at the same time. One of the things that I've been noticing a lot lately is, particularly in younger children, about this time of year, you start seeing flares in behavior. With a lot of kids, you start seeing where they're acting up more, they're getting into trouble more often. And if you, as a practitioner, when I watch it, I look for signs of physical distress in the body. So I'll look at the tissues around the eyes, I'll look at coloration of the skin, I'll look at how they're carrying themselves, their posture. Is their body mechanics showing signs of pain? Because what often happens with these kids is there will be chronic pain in their body that they just naturally live with, and then something will trigger it, like the cold that we're having. It was 9 below this morning here when I took my son to school. The cold will start triggering these pains, and these kids start spiraling up with their behavior. When I, as a practitioner, get my hands on these kids, not the parents are already doing this, I don't have to do that. When I get my hands on these kids to examine them and look in their ears and palpate lymph nodes and check pulses and look at tongue and what have you, one of the things that I often find is these kids have chronic ear infections. And you'll say, so the kids had tubes in their ears for how long? Okay. Has it really done anything? No, they still get the ear infection. Sometimes you'll hear, yeah, and the ear infection stopped. But these behavioral spikes keep happening. So then what you do is you start taking a look at these kiddos and you start palpating the neck and you start feeling a lot of tension in and around that C1 and C2, that top vertebrae. And what you start to realize as a practitioner is this poor kid's been in pain for quite some time, and they live with a certain level of pain, and then something triggers that ear infection, maybe the cold, maybe the playing outside, and that ear infection starts to spool up, that chronic sinus and ear infection, and now that headache that they've been dealing with all the time is just excruciating. And so then these little kids end up not knowing how to react to the increased pain stimulus. They end up acting out. So one of the things I have found with this pattern is when you start treating that chronic infection, that chronic ear, nose, and throat type infection, and I typically do it using some Chinese herbs, a Chinese formula called Herbal ENT, Herbal Ear, Nose, and Throat. You can take these kiddos and you can actually bring that level of inflammation up in the head down. And you can start clearing their sinuses out, and behavior becomes better, school performance becomes better, the distress that these little ones have been in for who knows how long starts to go away. Now, I realize this is oversimplified, but tubes are generally put in the eardrums so that the ears can drain properly and to reduce the risk of infection. But it doesn't really clear up the infection at all. It just provides the infection somewhere to drain to, which is nice, but it doesn't fix the problem. So these kids still have the infection. And in a family practice situation, it's surprising how often you see this. And they don't necessarily have to have behavioral problems, but when I see a child having difficulty in the lobby, that's one of the things I look at. I look at them from a clinical perspective of, is this child in pain? Is this child show signs of infection? Does this child show signs of any kind of pathological distress? And more often than not, the answer is yes. And so then we have to treat the child for that. So I wanted to share this with you because more often than not, the parents will come back in and say, I'm sorry that my child acted up. That happens a lot. And then you have to say, no. It's not because you're a lousy parent. It's because your kiddo is sick and needs some help. And we're going to have to actually get our hands on this kid and take a look and find out exactly what's going on. And we have ways of doing that without having to draw blood. We have ways of treating it without using acupuncture, although you can acupuncture children. Hey, look at this. Lo and behold.
Look what the cat dragged in.
Look what the cat dragged in. On the right hand of your screen, look what the cat dragged in. On the left hand of your screen, look at what the cat hacked up.
Oh, gosh. Make sure that these are off. I was treating.
You were treating.
Couldn't rush.
You did fine. I just let them know that you were with a patient.
Perfect.
And again, we talk about this from time to time, but
we go up until the end.
When you've got a patient that needs some extra time, they've got questions that need answered, we tend to just take the extra time and answer it. Mm-hmm. It puts you behind in other areas, but that just has to be sometimes.
Yeah.
And sometimes you have a patient that will throw you a curveball, or you'll get a walk-in that throws you a curveball, and you just have to focus on that individual. So welcome to the show.
Thank you.
I was talking about kids with chronic ear infections and how you can see that in the lobby. These kids will be, having periods where they're kind of
they'll feel good.
They just kind of look bland, and then all of a sudden they'll have a spike in behavior and they'll be going, acting out, and the parents will be embarrassed. But when you sit back clinically and look at these kids, you can see that the kid's got some signs of physical distress. Mm-hmm. And so then when you get an examination of them, you start realizing this poor kid's dealing with a very chronic ear and sinus infection.
I used to get them all the time. I used to have that pink medicine in the fridge.
Yeah, that was
but yeah, I remember it being like you'd be in pain, and then you'd have a period, I'm guessing, where the pressure went down in the eustachian tube. You feel good, like you almost had a little bit of pep. Yeah. And then it would hit again and it would hurt. So,
and what happens when you're living off of that pink medicine in the fridge? Amoxicillin.
Mm-hmm. You can't really have other stuff later down the line. It kind of burns you out with
it burns you out on antibiotics, but it also completely destroys your gut flora.
Yep.
So now digestion's a wreck, and now you're developing allergies to everything, which then further drives the sinus sensitivities. You see what a better show this is when she's here?
I was just the bubble kid, so you bring the stuff up, and I was like, oh, I probably had that.
You had something you wanted to talk about, right?
Yeah. So we were kind of discussing a little bit. Right now, it's popular for other illnesses to come up, like shingles.
It's chic.
Chic to have shingles.
Well, sure.
Oh,
Well, sure. It's this time of year where everyone's wrapped up in robes, walking around. You know, that was a bad joke. Go on, just ignore me.
well, and then it's differential diagnosis when people come in and they're starting to get that tingly feeling. You know, something isn't quite right, but you can't necessarily always see it right away because not everybody has the rash, you know, immediately with something like that. And then you're thinking differential diagnosis. Is this patient having a stroke? Does this patient have Bell's palsy that's starting? Is the shingles? And you're kind of going by the age and presentation.
What is shingles? Tell them what shingles is.
So shingles is when the chickenpox virus, after you've had it, goes.
It's a herpes virus.
Yeah, it goes dormant in a nerve root, and you don't know the nerve root that it's going to choose until it comes down the road later in life. And then it starts to kind of do the same thing with how chickenpox was. But instead of all over the body, it usually picks a dermatome or a certain area of the body, and it picks on it. And then you're either getting pain or you're getting the rash.
Little blisters that pop. And
Yep.
if you're touching those blisters and you touch someone else, you're going to infect that person.
And you don't always get those blisters.
Yep.
Because I've seen it too, that people, like, I remember when I first started out of school, this guy had them, never got the rash, but could not sleep. He'd be walking around in the park at night, like sitting on a park bench, doing whatever, because he was in so much pain he couldn't sleep. Yes, but he never got the rash. But, you know, it can even present lower in the back, like it's low back pain, but it's not responding.
You can get it in the eye.
Yep.
In not this stuff, but actually in the eye itself.
Because it's where the nerves come through.
That's right.
So you can treat it. I know you can work with it. Normal standard procedure in the Western world is you go in and they'll check you and see if you have the viral load, and then at that point, usually it's a steroid, I think, that they run to try to bring down that
Usually it's
process.
prednisone, and sometimes they'll do an antiviral, like an ivermectin or something.
But the faster you can catch it, the better it's going to respond.
Now, the way I treat it is, number one, I'll use NAT. Sometimes I'll use acupuncture. Usually I'll use acupuncture for somebody who, you know, they had shingles and the sequela is still there, and that nerve damage is there. So
that can last a while, months.
Sometimes it doesn't go away. The tragedy is when you get somebody who's had it for 5-6 years and you have to say, I don't think we'll be able to help you. And their pain score is about an 8 all the time. That's a nightmare. At that point, they kind of have to go in and have nerve cauterization done. But the way I treat it is I will do topicals, a topical salve that goes on there and kills the viral load, and also carries some nutrients to repair the nerve damage, cool the nerve. And I will use, because when this presents, it's what we refer to as liver fire.
Okay.
So I'll use something called Longdan Shegantan, which is a lot of fun to say. You'll find that with a lot of these Chinese herbs. Longdan Shegantan. It's just fun to say. It would look good on a t-shirt. Ooh, merch.
There you go.
But Longdan Shegantan is very, very cold herb formula, and it's designed to cool that liver. Well, what do we know about liver function? That's where everything gets dumped, right? So if you have liver inflammation and the liver's not draining, all of that sludge isn't getting pulled out of the nerves and dumped into the small bowel and out the body. So it's just sitting there. But once you start adding the appropriate herbs, you've got anti-inflammatories now in the body. You've got things that are dilating the liver and moving the liver. And that Longdan Shegantan works so well at just moving that heat out. So that one is just an automatic with shingles. Then I will do an antiviral as well. An herbal antiviral that works on regular cold viruses, But we'll also work on retroviruses like the herpes virus that causes shingles, because that viral load has to come down. Yes, you're working on it topically. Yes, you're working on it mechanically, if you will, by the Longdan Shegantan, causing the liver to start functioning in the body, to start metabolizing things. But you also have to kill things. There's a time and place for killing things. This is a great time. Go in there and just start killing the virus. So when you're dealing with somebody that is presenting with shingles, that's typically what I would do. Now, once in a while, and we were talking about this patient, once in a while you get a patient who's on warfarin or Coumadin. Those are blood thinners. These drugs don't play well with anything. You really shouldn't even be taking vitamins, multivitamins, if you're on warfarin and Coumadin, because it changes the chemistry of how that's reacting with the body, and it's just a bad deal. So when somebody's on warfarin or Coumadin, you can't necessarily treat with the herbs, but you can treat still with the topicals, and we can do something called NAET, which will turn the body's fight or flight response off and almost instantaneously start cooling that rash. It's phenomenal. If I can do all of these things together, we do it. But if you can only pick and choose,
if it's in the eye, what are you able to do with
you
that?
can still do topicals.
Okay.
You can still do topicals. You can do topicals. You can do herbs still. If it's in the eye, definitely Longdan Shegantan, because the liver opens to the eye.
Okay. Cool.
Ay, 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 ay. There's 4 people watching.
Nice.
Thank you.
That works. I bet I know 2 of them.
Let's do the answer to last week's conundrum. Do you want to do that? Do you want to read it or do you want me to?
I'll have you read it.
Last week's conundrum. Miriam Calabash was about to have a baby. Aww. The problem was her little one was not yet turned and was in the breech position. Her obstetrician, Dr. Huey Bone Marrow, also known by his luchador name El Trotiador, I don't speak Spanish, I never pretended to, I'm sorry, was convinced that he would need to perform a procedure to turn the child using external manipulation.
Oh, well.
Those are miserable. Mrs. Calabash was not too eager to undergo this procedure, as she had to endure it once before. Her friend suggested she visit the local acupuncturist to see about turning the little cherub.
That's cute.
That's just a fun word to say. Miriam made an appointment and went and saw Dr. Khan Nada B. Wong. After doing a thorough examination, Dr. Khan Nada B. Wong said, "No problem. The question is, what did the good doctor do to turn the child?" Now, we had 0, not a nil suggestions for what the answer could have been. Nobody called, nobody texted.
I know what the first part of this is because I smell it.
Well, yeah, I was doing this procedure this morning on a Lyme arthritis patient.
Cool.
Kid has Lyme arthritis in the foot, impedes function, so we do some moxibustion to try to reduce the symptoms. Yes, moxibustion. Now, that was the first half of the question. But what is moxibustion? Moxibustion is when you take the Chinese herb Aye. Now, that's not a funny little nocturnal creature from Madagascar with long, creepy fingers going, okay? Aye, that's an I.
Oh, okay.
Not to be confused with my daughter, whose nickname is Aye.
Mm-hmm.
Aye, which is the call of a magpie. See, there's so many things that play off of it. This is, put on your hip waders. Aye is the leaf material of the mugwort plant that gets grown, which over here we call it a noxious weed. Over in Asia, they call it medicine. Imagine that. But they pick these leaves and they dry them and they floss them. They just kind of rough them up to where it becomes this fluffy material. And they age it. They let it dry. Because all good things age. At least that's what Wayne Newton would have us believe. Anyway.
Anyway.
We take the herb, the aye, that's now been aged, and we either roll it into like a cigar and we light it and we burn it over areas of pain, or we'll put a needle into the skin. In this case, UB67, which is, if this were the foot, big toe, it's right on the outer corner of that small toe. So we'll put a needle there, which
sounds
could
painful.
stimulate labor.
Okay.
But and you want to be careful with that. But you then put the moxa on top of that needle and you'd light the moxa, and that moxa will cause that baby to turn. You can also just do the moxa itself over that point without the needle. It all depends on how far along the baby is, where things are at. So you've got those options, but you put the moxa right over UB67, and you add the moxa over that point, and that heat stimulus on that point will cause baby to turn.
Oh.
Most of the time, you don't have to have your OB put on his luchadora mask and put you into a pretzel. I don't use the needle on that point because A, it's uncomfortable. B, you want the baby to turn. You don't necessarily want to induce labor at this point.
Because it's not where it needs to be quite yet.
And there's better ways to induce labor. But that point is the one that you want to add the moxa to get baby to turn.
So you just kind of hold that moxa over that area, or?
Well, if this is the foot, what you do is you take the moxa in your hand. Let's say this was our moxa stick, and you keep your fingers on either. You keep your fingers on either side of it because you want to make sure you're not overheating that toe, and you're kind of doing this thing here.
Okay.
You're just putting heat in, but you're not wanting to fry the person's toe.
Okay, that makes sense.
If you need a stick of butter to do the procedure, it's too much heat. So
that's cool. I've smelled you do it, but I've never seen you do it.
It's a unique smell.
Do I get benefits from smelling that?
Actually, yes.
I like to think I do.
Back when they had the first SARS outbreak, you couldn't buy moxa because moxa, the smoke, actually killed airborne SARS virus. Does it work for this SARS COVID? No, it not that we haven't seen any studies that show that it kills us because of some very interesting reasons that would get us kicked off of YouTube. But it does show, it does work for killing airborne SARS virus. And there are some benefits with airborne flu viruses as well.
Cool.
Read between the lines. But during the SARS outbreak, what was it, 2001, 2002, somewhere like that?
Yep.
You couldn't get moxa because all of the Chinese hospitals were just burning it in incense containers. And you'd walk into the hospital and it would look like a bar in the 1970s, just curtains of smoke.
Because it was getting rid of the virus.
Just killing the virus. You wanna read Maggie?
Yes. Maggie from Whitewater, Wisconsin. I've been having pain in my pelvic area since the end of my last menstrual cycle. I have also had back pain. The pain feels like the dull aching I get a few days before my menstrual cycle. I've never had pain like this that lingers, and it is worse when I lay down at night. I do not have a fever or any other symptoms. The pain is just annoying at this point because it's going on 3 weeks.
Yes.
I am 32 years old and I have never had children. Is there something, is this something that is normal with age?
Number one, when your body's dysfunctioning at any age, that's not normal. Whether you're 12, 32, or 87. We got to get out of this general consensus that age is a pathology.
Mm-hmm.
So Maggie, no, this ain't normal. If you're having pelvic pain, number one, we would want to know where that pelvic pain is. Is it on the pelvic floor? Is it in the front, towards the rear, on the sides? Where is that pelvic pain? There's most likely a link to the menstruation issue. If you're having this pelvic pain, it's probably a lot more than just an inflamed pubic symphysis, although that needs to be checked. Because we've got this neat little link to the back, and I'm looking off camera at Slim.
Mm-hmm.
Slim, if you remember from previous episodes, he's our skeleton. He had an accident over the weekend. The place was being vacuumed, and they moved Slim, and Slim's feet fell off of his stand, so I got to make a new stand.
Oh, no.
So in the meantime, he's just standing lonely in the corner, giving us an odd look. I mean, look at his jaw.
Yeah, he isn't.
Hey.
He's not happy about it.
He's looking pensive about this whole thing, as pensive as a skeleton can look. I would want to know, what were some of the characteristics of your last menstruation? Were there a lot of clots? Was it bright-looking blood? Was it dark-looking blood? Did you have any cramping going along with it at that time? What else is going on in the body? Is there constipation? Any difficulties with urination? There's some follow-up questions that I would want to ask of you, Maggie. And it's a shame we couldn't get you to call in.
I was thinking too, like cyst.
Yeah. Yeah. And these are things that we would want to ask questions.
Yeah, differential diagnosis, so we could nail it down.
But most likely there's something cystic going on, a space-occupying lesion. So it's pressing on things that are causing trouble in the back.
Mm-hmm.
It's pressing on things that are causing trouble down below. And it's taking up space. Now, what would cause a cyst? A cyst, by definition, is a sac that fills with fluid, a little pocket of your tissue that fills up with fluid and then starts getting isolated from the rest of the body. So what can be done? Well, acupuncture does a very good job with causing cysts to leave the body. Sometimes it's not how you would like it to do, because it can cause those cysts to rupture and have to be metabolized and cleaned up. So with a cyst that's internal like that, we want to do some very gentle acupuncture, and we would do some herbs that would cause the body to start metabolizing it. Is it polycystic ovarian?
Maybe an egg didn't release but got trapped, and got inflamed, became a cyst.
There's a number of things that could happen. It could be infection. All of these things would have to be checked, and you'd be checked through differential diagnosis, which means questions. Follow-up questions.
Cool.
Joy in Tulsa, Oklahoma. I was in a car accident about 15 years ago and have been having severe headaches, ringing in my ears, and numbness in my hands and fingers ever since. The headaches are getting worse, and my prescriptions aren't working anymore. My pain is usually 8 to 10 out of 10, and I don't even want to get out of bed anymore. I'm 37 years old, and I feel like I'm 80. Is there hope? Number one, there's always hope. You just haven't found the right practitioner yet, Joy. I had a case very similar to this, and The lady came in, her pain score was 10, severe headache, sequela from a car accident when she was a teenager. And we actually cut the pain in half while she was on the table, and it stayed that way all week. So, yeah, there's hope. The trick is to find the right practitioner. In this situation, what are some things that she should be looking for that a practitioner, what are some things that her if she went and saw a chiropractor there in Tulsa, what are some things that a chiropractor should be looking at?
Well, I guess, are you having it, where it's the pattern of this headache? Is it your eye? I know she said she's getting ringing in the ears, numbness in her hands and fingers, or the other parts of the neck that she's having pain with. Is it her sinuses that she's having pain with? Is it at night where it gets worse, or maybe first thing in the morning?
Which fingers?
Mm-hmm.
Which fingers?
Because that'll go to the nerve root.
Mm-hmm.
Or if it's more of them, it could be even, thoracic outlet syndrome. Depends, from whiplash. She had that.
She could have been driving a little Mercedes SLR, one of those little pocket cars, because she could be a hairdresser. That's a hairdresser car, right?
Sure.
And maybe she's always like this all day long.
Mm-hmm.
Maybe she does have thoracic outlet.
There's a number of different things. Differential diagnosis, that's the key
that's
today.
what it comes back to.
Yep.
This is where on a medical show, you really, if you want to get a good answer, you really need to call in so that we can ask questions.
Follow-up questions.
Because it is a differential diagnosis. What do we mean by differential diagnosis?
Which thing is more likely the cause, but what things are possibilities?
We're wading through the weeds.
Mm-hmm.
I think last week we talked about the 8 parameters of Chinese medicine: ICDY, internal, external, cold, hot, deficient, excess, yin or yang.
And it brings you closer to what it is.
And what you're doing is you're zeroing in on what's going on. Because one symptom could lead you to any number of problems. In Chinese medicine, one pattern could be any number of Western pathologies, and one Western pathology could show up as 3-4 different Chinese patterns. I had 2 cases of kidney failure today with patients. 2 different kidney failure patients. Both of them 2 totally different patterns. One's a kidney yin pattern, one's a spleen qi deficiency pattern. Both are kidney deficiency, kidney failure. It depends, and so you need somebody that can go in there and ask the appropriate questions of diagnostics. Is there any hope? Of course, there's hope. The proper acupuncturist can get in there, get you some relief right away, utilizing some points around the ankles, points around the kneecaps, points around the wrists and hands. They should be able to drop your pain by half. If they can't, then you're probably further along and there's more structural damage. You should be talking to a surgeon. If a good acupuncturist can't bring your pain down, then there's probably more structural damage than can be fixed, in which case you're going to need to talk to a surgeon. I'm sure with a chiropractor, a good chiropractor.
You try to work with it, but if you're not getting the response you need and you're having continued loss of function, you don't want to prolong it any longer than you have to. And then neurosurgeon would be a good consult.
Yeah.
And then from there they can do the imaging and see what they recommend based on what they're finding.
But I would start by finding a good acupuncturist that's going to practice distal needling. In other words, instead of putting a bunch of needles around your neck, put them distally, put them in the knees, put them in the ankles, the wrists, the hands. You get a much stronger treatment that way.
Perfect. You want me to read Trevor?
Yeah, you read Trevor.
From Richmond, Virginia. Thanks for letting us write in our questions.
I just got done complaining about people writing in, and now he's. Thank you, Trevor. You're a sweetie. I don't care what they say about you at the Sons of Liberty convention.
I don't get to watch your shows until a couple of days after you air them, so this works perfect. Do you have any tips on how to get better sleep? I'm 45, I work a high-stress job, and when I get home, I just can't shut my brain off. My digestion isn't great, and I have some pounds to lose, about 35, and I have frequent heartburn. I've never been to a chiropractor or an acupuncturist before, but I'm getting desperate.
Funny how desperate brings people to us.
Well, they've exhausted the other means, and they start looking outside of the stereotypical stuff.
Yeah.
It sounds pretty common, though, what he's got, though. I think a lot of people go through that, have the same kind of pattern.
Trevor, can we just call you Everyman to be philosophical?
The everyman.
The Everyman. Yes, middle-aged, high-stress job. You're not getting exercise. Digestion's lousy because your diet's probably not that great. You don't move around enough, so you're not stimulating your body to digest food. The heartburn issue shows that the chemistry of your body's off.
Mm-hmm.
You're probably not producing enough acid, and so that little valve on top of the stomach is loose because it's pH driven. And so now what acid there is in your stomach sloshes up and gets you heartburn, and you're miserable. Your brain is constantly spinning because your liver's not draining because of chronic inflammation in the liver. Your liver's not draining the lymphatics, your lymphatics aren't draining the glymphatics, and you're just a gerbil on a wheel.
Mm-hmm.
With my luck, Trevor's 6'4", 250 pounds, 10% body fat, arm wrestler by trade, and he's going to come in and rip my neck off.
But he does want to know what he can do to get better sleep.
So there's two things that I would say start with.
Exercise,
move your body. See if you can get a good 3 hours of elevated heart rate each week.
That's not a lot for a whole week.
That's not a lot. That's the place to begin. And make it something that you enjoy. I can't go running. I hate running. I hate it with a passion. Your
lungs hate running.
My lungs hate running. The rest of me hates running. We never got along. Mainly because running pointed and laughed at me all of my life. Anyway.
But you do a lot cooler exercises.
There's other exercises you can do.
Qigong.
You can do Qigong. That's not going to be as great for elevating your heart rate. But Qigong is very good for coming down. So what I would say is do your exercise. At your age, you really need some good core exercises. So again, I would suggest Brazilian Jiu-Jitsu. If not that, some Judo. If you can't do that, pick up some Taekwondo. Pick up some martial arts classes because they're going to work on core strengthening without you even realizing it. And it's not going to be sitting there in a gym lifting weights, staring at yourself saying, I hate this. At least that's what's going through my head when I'm lifting weights or trying to. I hate it.
I don't mind the lifting weights. The cardio, I can walk. I'm not a fan of running unless it's like sprint walk. Some of those exercise bands aren't too bad. If you're doing more body weight, if you're doing it correctly.
I would prefer to swim.
Yep.
To that. I
love swimming. Sometimes it's just not easy to do it after work.
We're in Wisconsin. Where are you going to go for a good hike? Mm-hmm. That's close by.
In the wintertime, you're probably looking more at a treadmill. Sometimes at the Wise, they have a track that'll go around that you can kind of do that. Or they'd have the pool, different options. But yeah, outside right now it's tough. This is the worst part of the year. We got the polar vortex going through right now. You really aren't supposed to be outside. Yeah. Because you might lose an ear or a nose. But
maybe you want to look like Van Gogh. I am an artiste. I guess a Dutch guy wouldn't talk that way.
I think exercise will burn off some of that stress.
Exercise would be the place to go, even if you found a boxing gym. It's not necessarily going to be core workout, but it's going to be working on neural connections. It's going to be meditative.
Mhm.
I mean, people don't normally think of martial arts, fighting, punching, kicking things as meditative, but you are focusing in on your body's movement and your mechanics. It's very meditative. Blood pressure comes down. But then when you come home, I would say practice, set up a ritual, set up a pattern that's almost ritual. And when you come home, this is what you do. You put your keys here, you put your cell phone over here, and you leave it there. If you can shut it off, shut it off. Don't put it by your bed. Leave it way out here. Don't look at any screens. Eat a decent meal, not a big one, because you don't want to have a lot of food in your gut before bed. Drink something warm that's going to be relaxing. Read a book for a little while. Start coming down. Do some Qigong exercise. Not the stuff that's supposed to, give you energy and tune you up.
Yeah.
Do the Qigong exercises that calm you down. That's practicing deep belly breathing. Deep belly breathing alone is going to start bringing blood pressure down. Then start getting around for bed. Go in and clean up, take a hot shower, wash your face, whatever you got to do.
Get yourself there.
Put on your pajamas, get into bed at the same time every night. This is key. Journal for a little bit. Read your Bible, read whatever it is that you're going to read. Turn the light out and go to bed. If you need to, get one of those funky masks that cover your eyes so that you can't see anything. And sometimes you can get them where they're weighted, and they put some weighted pressure over your eyes, and that's very relaxing as well. Do it. And you're probably going to struggle for a couple of weeks. But as your body gets used to this, boy,
New
that
rhythm.
felt nice.
Right.
As your body gets used to that rhythm, you're going to be falling asleep easier and easier, and you're actually going to be sleeping deeper and going through more cycles of your sleep. You're going to get better sleep.
Mm-hmm.
Wake up at the same time every day. Don't rely on coffee to wake you up. Rely on your pattern to wake you up. Get these sleeps. Then anything that happens in between, let it happen. But your body will be trained that, okay, as soon as my keys go here and my phone goes here, I'm off the leash.
Mm-hmm.
I can go do my Qigong exercises. And that, Trevor, is going to go a long way towards helping you sleep. If you can get into a chiropractor, let the chiropractor work on your nervous system.
To calm it down.
Let them get you calm that way. If you can get to
Same
an
with yours.
acupuncturist, let them get you out of fight or flight mode.
Mm-hmm.
Let them get you into an autonomic mode. It's going to help. If you can do all of these things together, best case scenario. But you will sleep again. You ready for the conundrum?
Yeah.
The conundrums are just fun. Do you want to read it, or do you want me to?
I'll let you read it. I was just sneaking what the other question was.
This week's conundrum. Earl Cronwire was traveling from his home in Chickasha, Oklahoma, to his friend's house outside of Barstow, California, where he was to be the keynote speaker at the annual conference of the Jay Silverheels International Fan Club, which I'm the founding member of the Jay Silverheels International Fan Club. I didn't even know this was going on. He was to be the keynote speaker at the annual conference. Do you know who Jay Silverheels was? He played Tonto in the original Lone Ranger.
Oh, cool.
He was kind of a neat cat. The Jay Silverheels International Fan Club annual conference, which was being held at the Carl's Jr. restaurant on Linwood, just off of Route 15 in Barstow. Rather specific. High class. We're a high class group. He was told that they would be feasting on jalapeno burgers and discussing the filmography of the late Hollywood icon. Earl could hardly wait. Earl's a man of adventure. But as he drove closer to Barstow, he felt sicker to his stomach, and his stomach began to gurgle and get louder and louder.
That's not good.
No. He stopped over at it could have been the little cheese sticks that you get at the highway overpasses.
That's not good.
Earl. He stopped over at his sister Gertrude's in Las Vegas, who took him to see her acupuncturist, Dr. Ivana Poksum. She's from the Ukraine.
That's great.
The good doctor diagnosed Earl with food stagnation, gave him an acupuncture treatment and a single Chinese herb. What was the herb? This is unique because Chinese practitioners don't normally give a single herb.
Mm-hmm.
Normally we give herbs and formula, except for this time. The question is, what was the single herb that was given to Earl? What did Dr. Ivana Poksum give Earl for his stomach? Now, in order to do this, you're going to have to go through his rather colorful and lengthy presentation here and make some determinations on what was going on. You'll have to do a differential diagnosis. Hi, CDY. I hope I don't get sued for that. If you think you know the answer, call us 608-314-8791. Tell Carrie what your answer is. Leave your name and phone number. And if you win, we will give you $10
to the apothecary.
To the apothecary at the Siloam Center, where you can get things like rescue balm and toothpaste and cough drops
and eye cream.
And if you request, we might just send you a kazoo.
That's in your apothecary?
No, but we can get one.
Okay.
I'm going to the Guitar Center this afternoon.
I wanted to look where that kazoo was otherwise.
I'm going to the Guitar Center this afternoon. I can pick up some kazoos.
Cool.
We also have xylitol suckers if you choose. Send in your answer. You can either call it in, type it out to info@siloamcenter.com. And if you've been having trouble figuring out how to spell info, INFO, at siloamcenter.com. It's possible. I can't spell worth of beans. You know why doctors have lousy handwriting? Because we have big words to spell and we don't know how to spell them. That looks about right.
Pharmacists have to have the hardest job out of all.
Well, that's why they've got some of the most schooling. Let's do Harold.
Okay. Harold from Bloomington, Illinois. 65 years old, constant jaw pain, and it sticks sometimes and I can't move it. I have been going to massage therapists, but didn't like it when they wanted to put their fingers in my mouth. Is it something that a regular chiropractor would do to help this? I wasn't expecting to read that. That's usually how some of these go.
Yeah, sometimes you'll find a massage therapist that'll want to go in and work from the inside. Is that necessary? Depends on their training.
Mm-hmm. And hopefully they're using a glove. That's if they're being courteous.
Well, and you'll see I've even heard of some chiropractic adjustments where they'll glove up and they'll go in there on both sides.
Yeah, I've watched some of those too. They're more muscle work.
Yeah.
Not so. They're muscle not really.
Releases.
Yeah, they're not.
And they're excruciating.
Oh, it's tender.
Yeah.
Mm-hmm.
Harold, there's options out there.
Mm-hmm.
What would you do in this situation?
And I've worked with jaws because the jaw doesn't just go. It goes in a figure eight.
Yep.
Yeah. The big jaws. It goes in a figure eight motion, so you can't just treat it like a hinge because it's really not. So I'll work on the masseter, I'll work on the pterygoids, and then I'll also work up by the temporalis muscles to help balance them. I'll have the patient open and close their jaw just to see which way it deviates, because sometimes you get a C deviation where it'll open and it'll swing one way. Sometimes you'll get kind of an S shape where it'll bounce from one side to the other and come
Kind of
in.
like when my grandfather used to choose coffee in the morning.
So you just have to see, because that'll kind of tip you in of what muscles are imbalanced. Is it maybe high on the left and low on the right? And you have to work with those. Also, C1 is a big player if the jaw is off.
Always look to the neck when the jaw is off.
Mm-hmm.
Now, I'm gonna share a tip with you. Right up here, right up in here on the hip, there's a point called GB31.
Green Bay, number 31.
Geraldine Bavinovitz. 31 years of age. Maybe she lives in Chickasha, Oklahoma.
Yeah, that would be easy to remember.
Look her up. That point is very helpful. In fact, I use it all the time when there's problems with the TMJ. That point, it's kind of tender, and if you massage that point, Harold, while moving your jaw, do it long enough, and you'll probably feel that pain decrease. A good acupuncturist isn't going to put a bunch of needles in around your jaw. They're going to actually go to your hip joint, go to GB31, go to points around that trochanter, go to points around your thumb and that little, there's a V here where the bones come together.
Mm-hmm.
They're going to put a needle back into that joint. Most of the time, just doing GB31 and kind of turning the needle a little bit while you're going ba, 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 suddenly that pain goes. There might be a pop while things get lined back up, but that pain will go. That pain will come back if they don't treat the neck too, though.
Mm-hmm.
What you do to one, you got to do to the other. Sort of like an equation. What you do to one side, you do to the other.
Balancing equations.
Because that's all tied together.
Mm-hmm.
And if one's pulled off, the other will be off.
Yep.
Do we have time for
the last one?
Kylie. Do you want to read it?
Sure. Kylie from Appleton, Wisconsin. I have a 7-year-old boy who has food allergies, and now that he has started school, we are learning that he has learning disabilities. He has some behavioral problems and gets irritable very easily. We've tried just limiting his diet, but it doesn't really change the problem much. We're thinking about seeing an alternative practitioner, but don't know what would be best. Do you have any suggestions?
Number one, whenever someone says alternative practitioner, I always think of some wacko in a grungy black t-shirt listening to Green Day. I don't know why. Usually in their parents' garage, too.
Those ones are getting older, too. They're not young. They're not young people anymore.
It's so weird, too.
Yeah.
I remember when the Rolling Stones were the old guys. Now they're just really old guys. I was talking about this at the top of the show. You know, where you've got chronic infection. Kylie, we don't know if your child's been on antibiotics up to this point. We don't necessarily know all that's going on, but all of these things go together. Behavioral difficulties, learning disabilities. You know, you're going to be told from the psychologist at school, you're going to be told from all these different people, well, it's genetic. And then you look at your husband and say, you did this! Not necessarily. Just because you have genes doesn't mean you have to express them. Just because someone buys you those stupid skinny jeans doesn't mean you have to wear them. So I would be looking for signs of chronic infection in the kiddo. I would be looking at isolating what those allergies are, not just allergies, but sensitivities. Number one, start with removing gluten, dairy, and eggs. And make sure anything that's left is organic so that you're not having the glyphosate issue. We've talked about the chemistry of the glyphosate and how it interacts with brain chemistry. Look at previous shows. But if you've tried limiting his diet and it really didn't change the problem, you're probably looking at the wrong nutrients in the diet. You're probably looking at the wrong characters. And it could be not just one item, but a blend of items in the diet that are causing chemistry.
And if he's not feeling good, yeah, he's probably acting out.
Yeah.
Because he doesn't know why he feels that way.
It could also be mold in the environment. Is there mold at school?
Oh.
You better believe it.
I think that's like written into their budgets, isn't it? For a little bit of mold.
Well, when we were kids, it was asbestos. Well, when I was a kid, it was asbestos.
I don't think they have as much asbestos
Now it's
anymore.
mold.
But yeah, it's
now they've
there's always
cycled
mold.
all that out.
Every school I've ever been to, there's always been mold. High school is just bigger buildings that kind of goes with the territory.
Well, I used to get I hated school, and that's probably why. I was always sick at school. So I would look at checking him for allergies, checking him for sensitivities, checking him for chronic infections. But he's only 7 years old. Yeah, chronic is anything over a few weeks of age.
Yep.
If you've had an infection for more than 4 weeks, it's considered chronic by definition.
Just like you were talking about those ear infections, chronic ear infections in kids, and I guarantee a lot of them are under 7.
Yeah. Do you have any suggestions? Yeah, there's, get a hold of me. Call us 314-8791. I actually know a chiropractor or an acupuncturist up in Appleton area who's very, very good. Pam, I can't think of Pam's last name. Anyway, she's astute with NAT, so she can help your child work through these allergies and desensitize to the allergies. She does a lot with microcurrent. Microcurrent has been shown to help a lot with behavioral issues as well as cognitive function. You can do microcurrent on depression and anxiety and help bring these things under control just with microcurrent stimulation. She does acupuncture. She's trained in nutrition. Pam Koski. Look up Pam Koski up there in Appleton. She's very good at what she does. You wasted a perfectly good hour with us, and I thank you. If Mercy's watching, if you're one of the 4 people that have endured the last hour, honey, I'm coming straight home after this, and we'll go to the Guitar Center and pick up your cajon drum. And then we'll get Zecco. Anything you want to add?
No, I think we got it.
On behalf of everyone here at the Siloam Center, Slim, Carrie, Norman, Noel, Mo, and everything else that might be hiding out here. Thank you for watching and have a wonderful week. Shalom.
Bye, guys.